today. So I'm going to share. No, it didn't work this time. There we go. Have you got a new slide there? Because it's not showing anywhere on my computer. That's all right. Work in progress. So today we are talking about uterine fibroids. I am calling this an invisible epidemic because in the US, 70 to 80% of women will have a fibroid tumor by the time they're 50. So imagine this statistic for a moment. I am going to ask you to put yourself on gallery if you aren't already. And then in a minute, there you go. And so if you can put yourself on gallery and look around you, it's not a whole huge room full of women, but if it's 70 to 80%, there's a good chance that someone in this room, I know for sure one, might have or have had or will have experienced this challenge of fibroids. So I want to put you all in gallery too. Okay. So it's an issue at this point that really goes beyond numbers, isn't it? It's personal, and it's something we're going to talk about today. So let's go on a little quest together in the chat. Type a yes if you have ever heard of fibroid tumors or know what they are, and a no if you don't. Because I am finding out a lot of women don't even know what they are. So if you're interested in learning more, okay. So we're going to talk about that. If you're interested in learning more about fibroid tumors or in healing them naturally, you're in the right place. I've scheduled 90 minutes, but I want to make sure that everybody gets what they came here for. So I'm leaving a half hour at the end for Q&A. So if questions come up during the talk, you can put them in the chat and we will get to them at the end. So now I'm curious to know who among you have or have had fibroids? If so, put that in the chat now or in the past. Because I am meeting so many women every day that say, oh, I wish I knew you 20 years ago. I mean, it seems like all my friends have had them too. So do you know a woman who has fibroids? Okay, well, that's kind of the endometriosis is kind of in the same category. It's a women's disease that's not very attended to. So I'm just trying to really get myself where I can see everybody. Okay, hi, I am Dr. Rainbow Casey, and I want to take a moment to share a bit about who I am and why I am so passionate about guiding women towards vibrant health and longevity. And well, what I mean by longevity is that your health gets better every day of your life. So my recent blood test showed that I have the biological age of 43. In about a week or so, I will be 76. I am so grateful that I'm getting healthier every year. My energy is fantastic, and I don't have any fears about my future health. But it wasn't always like this. From infancy, my life was marked by serious health struggles. I was a frail child who was always sick. And I spent over 3 decades grappling with constant serious diagnoses. It was so bad at times, I really didn't think I could keep living because there just didn't seem to be any help for me, even when I was part of the medical system. Unfortunately, like many who have struggled with chronic illness, I often felt like a helpless victim. Like my body was my enemy. And sometimes I was just hopeless. I mean, if I met one of my medical school classmates, I am sure they would be surprised that I'm still alive.
Wow.
Med school was in and out. But anyway, of hospitals, it got to a point where I even questioned my choice to be a doctor. I mean, the system failed me all those years. And my first doctor job was at a university. And I felt like somehow we failed these young people because they kept getting sick. So I started questioning. It was the 70s. And I am so grateful that at the very beginning of my career, I had several transformational experiences that reshaped my perspective on health and disease. I had two epiphanies that totally changed the way I looked at medicine. One was the work I did with martial artists in Aikido and Tai Chi. They worked with this powerful, invisible energy that I sure didn't learn about in medical school. If a small woman can break a brick with her hand, she had to be channeling all the life force energy of the universe, I call that she, and using mind over matter. I thought, if you can do that to a brick, surely you can do the same thing to heal the body. So I added energy medicine in my practice, like homeopathy and Qigong, and a healing mindset, which I've used for decades to have dental work without anesthesia. The other life-changing awareness for this girl who had been sick her whole life was that of personal responsibility for one's own health. You know, the medical system turns us into victims. I am broken. You must fix me. I mean, if you have ever had a serious or chronic illness, I think you know what it's like to feel like a victim, or even like your body is your enemy. It's a horrible thing to feel helpless. So, okay, it may feel daunting to take responsibility for all of your problems, including medical, but the fantastic upside to that is that you can heal yourself. And that is exactly what I did and what I've been doing with my clients for almost 50 years. I was the first holistic MD in New York City in 1975. I had a family practice, but because I was the only holistic MD in New York City doing gynecology, I ended up assisting countless women on their journeys to wellness, all without resorting to surgery or pharmaceuticals. I became the holistic fibroid doctor, and I worked with many women and witnessed them week by week shrink their tumors, avoid surgery, and change their lives. Curiously enough, life took a turn, and I found myself in a situation that I had helped so many others overcome. I discovered that even I, the fibroid doctor, had developed a fibroid. No, no way, this is absolutely impossible. This can't be. I decided I had to use everything that I know to heal this. And I spent a few days completely immersed in healing myself. Astonishingly, when I got the sonogram, the fibroid had vanished. I am grateful that happened. It's the classic physician heal thyself scenario that I've been doing my whole life. I practice what I preach. I consider all of those illnesses that tormented me to be gifts, allowing me to understand my clients and to learn firsthand how to heal myself and others. Now, After pulling myself out of what felt like a hopeless future, I am so happy that I get to help other women do the same thing. Can you think back to a time in your life when you felt like your body was your enemy, or like you were a victim of an illness? How did that make you feel? It's okay if you think about it, or it's okay if you share it also in the chat. I know how I felt for most of my life. What I want to share is that we can all be the hero of our health story, and we really do have the power to heal ourselves. As I become more and more aware, as I'm studying this invisible epidemic, which has exploded in recent history, I'm really excited to offer this Fibroid Freedom Program to help women in their journey to wellness. This is not just a program about getting rid of tumors. It's also about getting yourself healthy overall so that you can defy aging by getting healthier every day of your life. Because ultimately, that's what I want for all of my clients. I thought this talk was about shrinking fibroid tumors because I've helped so many women do that. But now I realize it goes so much deeper than that. I mean, if this is really that widespread, what I want to do is help women prevent them. So here's what you're going to learn today. We're going to talk about just what fibroids are and how they affect the body. We'll look at conventional versus natural healing and why it's so important to not just eliminate the tumors. And then we will talk about 3 keys to healing that you can start working on right away. And later, I'll tell you about a free gift I'm offering. If you're interested in getting more support, I'll be letting you know about an easy next step that you can take at the end. So I'm going to share my screen again. Okay, so we're going to talk about the 3 keys to your natural healing journey. The first key we're going to talk about is educate yourself. So let's talk about uterine fibroids. Before we go into details, I want to share some statistics. The NIH estimates that 80% of all women will develop uterine fibroids at some time during their lives. And because many women don't experience any symptoms, it's possible the incidence of fibroids is even higher. Some NIH researchers have pointed out fibroids are a major public health issue. They have been the leading indication for hysterectomy in the US for decades. I want to see you guys again. In an extensive study of ultrasound screening, I have to say this blew me away. There's this big study studying women taking ultrasounds in women under 50 who had never been diagnosed with fibroids. They showed that they were present in 51% of women. The conclusion was if you look for uterine fibroids in women in their late 30s and 40s, you'll find them the majority of the time. I recently Googled, what are the common medical problems that women have? Nowhere in that list were fibroid tumors. 80%? Why do I talk about this first? Because I am appalled at the fact that women's health is being ignored by the medical establishment. Okay, I mean, it's not so different with other areas of our lives, with sexism infiltrating politics, business, education, religion, most of our institutions, right? But our health, I'm upset. There are so many women suffering and being ignored and not even being tested. In a minute, we're going to talk about some common symptoms of fibroids that women might not even know about, especially since doctors don't even take them seriously. Serdar Bulan, one of the few doctors in this country doing fibroid research, says, though fibroids are the most common tumor in women, they aren't studied enough. He also says, although we define uterine fibroids as a benign disease, it's not that benign. It destroys a lot of lives. I had a patient years ago. I was taking her medical history. She said, oh, well, I had a hysterectomy. And I said, okay, what for? And she said, I don't know. The doctor just told me I didn't need it anymore. Really? We have been kept in the dark for too long. I just found out that a close friend of mine, who I know quite well, had a hysterectomy like 60 years ago for fibroids. We don't even talk about this with our friends. And certainly we don't talk about our uterus at a dinner party, do we? But we'll talk about heart attacks, strokes, arthritis, COVID. I want to share something about my medical training. In the early 70s, I became involved with several feminist clinics that were springing up all over the country. So I was trained in these clinics how to do a pelvic exam. Well, yeah, I was trained in medical school, right? But what they taught me was different. Stirrups, degrading. They even used them against gravity to deliver a baby. Newsflash, you don't need stirrups for a pelvic exam. I realized that male MDs created the specialty of gynecology. And even the women gynecologists were essentially trained by men. I remember in medical school, I was taught. Now remember, students, pregnancy is a disease. What? Women have been having babies for millennia. What's wrong with this picture? So I have another question for you. And I think I know the answer. How many of you have had a pelvic exam or delivered a baby with stirrups? How does that make you feel? I mean, I remember my first pelvic exam, like when I was 19. I didn't even know I was such a naive kid. I didn't know what anything was. I mean, that was just horrible. Feet up in the air. Anyway, you know what I'm talking about. So, what I'm going to do, because we've had, I've talked a bit about statistics and stuff, and we have a lot of information we're going to cover later. So I want to take a little break, if you're willing, to stand up or do it in your chair. I do also teach Qigong, so I'm going to do a Qigong exercise. I gotta make sure you can see at least my head. I call this the wake up exercise. It's really a form of self-massage where we just kind of energize our whole body. Now, I'm not going to be able to see for a bit because I got to take my glasses off. So we're going to start off nice wide stance, leaning forward, and I want you to rub your hands together till you make heat. So I want the fingers to interlace, not just to rub, but have them soft, and so that you can really use all parts of your hand and fingers. So in a minute, keep making heat. In a minute, I'm going to tell you to raise your hands and put them on your face with the middle finger against the nose. So keep doing it. And then I'm going to ask you to inhale and hold your breath as long as you can when you put your hands on your face. Inhale. Let the heat soak in and hold your breath as long as you can. And start rubbing. Keep the whole hand on the face, not just a bit of it, soft hand. The middle fingers rub up and down from the middle of the eyes down to the bottom of the nose. Just rub your face. Try to cover as much as you can. I think I can see. And now with our thumbs behind your ears, you're just going to rub up and down, kind of vigorously, and keep breathing. You're allowed to breathe now. Now, again, you're going to have to watch this because you're going to cover your ears, and I want you to hear the instructions. So what it's going to look like is really cupping your ears with your hands with some pressure. And then the rest of your fingers are behind your head. And then you're just going to push in and out. So that was kind of like, I don't know if you felt it. It was kind of like exercising your eardrum. Now we're going to put our hands on our ears again. And this time we're going to tap the back of our head with our index fingers, like so. So I hope you heard that cool little sound. All right, so let's see, what are we going to do next? Let's, oh, we didn't do the back of our neck. We'll do that now. Okay. Let's put one hand on over your ear, and the other hand is going to rub the back of the neck, and the little finger goes from one ear to the other ear. So and change. Okay, let's whack ourselves in the forehead with our fingers, with our index fingers. And then with a very floppy wrist, we're going to, and this flat part of our fingers, we're going to tap over our skull every place we have hair. Okay. I usually do a more elaborate thing, but this is a little shorter. So now I want you to shake your hands, really shake them like you're trying to knock your fingernails off. I mean, like, get off of there, just as hard, just shake them loose, and shake your hands. We're really trying to energize all the energy meridians in our body. And now let's do a little Tarzan. Let's just slap. Little Tarzan all over our chest. And let's do some arms. So one arm is straight out in front of you. With the other one, we're going to tap down the outside and up the inside. Real floppy wrist. And the other side. And now one arm with this, the inside of your hand up against the sky. So we're going to raise our hand and then rub along the torso. And the other side. Okay, now let's do clockwise circles on our belly. That's the direction our digestion moves, so let's go with it. And then again, floppy wrists, but just a loose fist. We're going to just gently tap over our kidneys. And now with the nice strong fist, because the glutes are big muscles, we're going to tap on our hips, our glutes. And now with a wide stance, if you're standing, we're going to tap down the outside of the legs and up the inside. Down the outside, because that's the direction that the yang meridians go. They go down from the sky, and the yin come up from Mother Earth. Okay, that's a little abbreviated, but I don't know about you, I think I do feel a little bit more awake and alive. And that, I don't know how much time that took, but you know, you can do it in 5 minutes, really. And it's a good thing to do first thing. I used to teach martial arts at the local college, and you know, I used to teach the students, do this in the morning or before an exam or something. So, okay, now back to the first key of educating yourself. So what are fibroids? They are benign tumors of the uterus. They're called leiomyomas, which is a fancy word for smooth muscle tumor, because the uterus is a muscle. They're usually seen in the reproductive years, but they can show up in a teenager or a postmenopausal woman. They can be single or many tumors, from the size of a pea to a term pregnancy. I had a patient once whose fibroid was the size of a 20-week pregnancy, which means up to the belly was filled up to the navel. And every week when she came in and I put my hand on her belly, I felt it get smaller and smaller and smaller every week. Now, not everybody's fibroid is that big, but they can be much smaller and still have horrible symptoms. So they're diagnosed by physical exam and ultrasound. So any woman who has anemia should be checked for a fibroid, and any woman with any of the symptoms that we're going to talk about should be tested. So we're going to talk about some of the common complaints and problems and symptoms that women are facing. Each woman's experience with fibroids is unique, and many women don't even have symptoms. But in those who do, there can be a huge range, which can even be debilitating. So I am going to share the next. Oh, come on. All right, give me a minute because it's, let's do this slide. Yes, thanks for your patience. And now we're going to share, just so you can follow along with me, really. Talking about the symptoms. And as you go through these, well, you can make your own conclusions, but I have a hunch that a lot of us women have experienced some of this. So the most common is heavy menstrual bleeding. Now, this can actually lead to anemia and fatigue and the need for blood transfusions. That's not uncommon. And the thing is, women just take this in stride as normal. I mean, it's like, oh, well, I guess I have to use the super pads now. I mean, that any woman with anemia or heavy bleeding should be evaluated for fibroids. And doctors oh, well, a lot of women have heavy periods. Same with painful periods. I don't know about you, but oh my God, periods for me when I was younger were torture, the pain, the discomfort. And again, because doctors, at least originally, most of them were men and they grow up in our culture. I don't want to get too political here, but they've been raised, again, not to talk about a uterus at a dinner party. So, taking these things seriously, I don't think is happening. There's no reason why we should have painful periods, okay? And a lot of times there's pelvic pain and pressure. It can be mild, it can be unbearable or constant from the pressure of a tumor in there. The same thing, your abdomen can be enlarged from a large fibroid. And a lot of women think they're just gaining weight, not realizing that that belly is from a tumor. It can cause menstrual irregularities like irregular cycles or spotting between periods. Depending on where they are, it can actually cause pain during sex. Infertility is not unusual. They can interfere with conception, leading to difficulties in becoming pregnant. And then there are complications if you do, because the hormones of pregnancy usually cause the tumors to grow, sometimes rapidly. So they can cause complications like miscarriages or preterm labor. You can get urinary symptoms if they're pressing against the bladder, and you can have frequent urination, urgency, difficulty emptying the bladder. It can even cause recurrent urinary tract infections. You can get bowel symptoms if they're pressing on the rectum. You can get constipation or discomfort during bowel movements. You can get bloating by a fibroid pushing up into your stomach area. It's not that unusual to have back pain, especially if they're pressing on the nerves in the lower back. The exhaustion and fatigue can come from just chronic pain or anemia or even emotional distress. So as far as the emotional distress for women dealing with the physical symptoms and the potential impact on fertility can be a problem. Some of the reasons for extra stresses are body image, loss of control, feelings of hopelessness, sexual or relationship problems, which then causes many women to have challenges with depression or anxiety, frustration, reduced quality of life, and distorted body image. So I'm curious, again, if you want to share, this goes for any of us. Do any of you have or have had any of these symptoms? I mean, I think it's not that unusual, right? Now, if you have or have had a fibroid, if you're comfortable, share one word about what your biggest struggle has been or is on this journey so far. And if you want to share that with us. Because I do recall seeing that at least one of you has or has had a fibroid.
Hi, I would like to share. Currently, I am dealing with infertility. So that's one of the major issues with the fibroids that I do have currently. I do have two. Back in December, I went to have an operation to remove them. Well, once she got in there, she could not remove them because of the placement of them. And it was going to cause a hysterectomy. So she, of course, wanted me to do a hysterectomy, but I refused. So then I decided I was going to go on a natural healing journey to heal my fibroids naturally.
Oh man, I'm so sorry for what you've been through. Oh, that's hard.
Thank you.
But I really am so proud of you for standing up for your womanhood, really. So we are going to talk about some of those things. So let's talk about causes for a minute. Thank you for sharing that. That was Crystal, right?
Yes, ma'am, no problem.
So the standard theory is that no one knows for sure what causes fibroids or what causes them to grow or shrink. Well, how can that be when 80% of women will have them? Are we talking about sexism in medical research here? I mean, is it because, well, they usually won't kill you, so they're just a nuisance? Or are the causes so complex that there's not an answer that conventional medicine can understand? They do know or think that they respond, well, they do know they respond to hormone changes, especially estrogen. Some theories include genetics, that's always a good throwaway, lifestyle choices, including poor diet, eating a lot of meat, drinking alcohol or caffeine, or not drinking enough water, obesity, hypertension, early menarche, which means the age at your first period. Dr. Boulin's research, one of the few who's actually researching this, his research correlates with eating meat, with chronic stress, and with obesity. Most of us have at least one of those. Louise Hay says they're from nursing a hurt from a partner or a blow to the feminine ego. A groundbreaking study, which followed more than 60,000 women over 16 years, found that those who were abused as girls were more likely to develop uterine fibroids decades later as adults. Practitioners working with fibroids have reported that they're often associated with conflicts about creativity, reproduction, or relationships, feeling a lack of intimacy or sexual issues. I mean, having a baby is the ultimate creative act, and inherent in feminine fertility is this connection with creativity. The experience I had in my medical practice was that I saw women who were either not in touch with or suppressing their feminine nature. Like many New Yorkers, they were ambitious, driven, professional women. I found that I could begin to diagnose fibroids without ultrasound by just putting my hand on their lower belly. In women with fibroids, I felt an area that just felt dead, like cold, lifeless, no energy, as if the energy to the womb was missing. And it happened across the board. I mean, I'm pretty good at feeling energy, but it was so strong. I mean, I would feel their belly bump, 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 bump. I get down there, dead. So I'm seeing that also as, just not having the energy in our feminine center. So I want to see if I can, here we go. I'm going to share another slide. So the reason I'm showing this slide is, well, for one, this is interesting. I changed this slide, but it's okay. It works too. I'm just the picture of the uterus to be able to see the fibroids can occur inside, outside, all around the whole uterus. But the real reason I'm sharing this slide, we're talking about conventional treatments for fibroids. You see all those things on the bottom under treatment? Every one of those is a type of surgery, except for the medications, which, as you'll hear, are no picnic in the park either. So the traditional approaches, for years, they have just been doing a hysterectomy and telling women you don't need it anyway. But then all these other procedures, they're less invasive, but they are all type of surgeries. And let's move on to medications then. Mostly they're a type of hormone, such as they sometimes use birth control pills, which actually increase estrogen, which causes fibroids to grow. And then there are even IUDs that have hormones implanted in them. And here's my favorite. Several of these hormonal medications that they use create a false menopause. Okay, so you've got a 35-year-old woman with fibroids who might still want to have babies, so you put her into menopause. I'm sorry, none of these really work for me. Oh, and then another thing they do, they just watch and wait. And that's one of the things that I've had other women, they say, well, we'll just kind of watch and wait. Meanwhile, you've got a tumor growing or not growing, symptoms or not symptoms, because their treatment is usually surgery or horrible hormones. The problem with a conventional treatment is that it can be dangerous. There is no drug, especially hormones, without side effects. And I'm sorry, there's no surgery without some type of risk. But the biggest issue for me is, unless you actually get a hysterectomy, is that these treatments don't protect you from the tumors returning. And I hear women telling me, oh, well, yeah, I had the surgery, but they came back. So I think you have to do, a more holistic cause approach. The treatments I use are safer, and they don't just focus on the tumor, but on your overall health. Because it's such a complex disease, there needs to be a multifaceted approach. Okay, so yeah, it's probably going to require a change in lifestyle. The niche that I've been working with for, almost 50 years has been longevity, and I help people stop the aging process. And especially when I'm working with someone who's older, it's like, yeah, you can reverse aging, but not by sitting on the couch and keeping your lifestyle. So yeah, usually self-healing does require getting on some kind of a healing lifestyle. If you're overweight, you will need to lose weight, because in my experience, fibroids do go hand in hand with your weight. But my Fibroid Freedom program will make that easy to do. So the other thing you need to do is to nurture your feminine self. Now, the technique I use to actually shrink the tumors is therapeutic juice fasting. Not only does it shrink the fibroid, but it increases your overall health and starts to reverse the aging process. Because, it is a growth in a tumor after all. You do need a lot of serious things to help. But number one, regardless, for everything I do, every disease I work with, number one is always mindset. Isn't that true of life? I think anybody on a self-improvement path is realizing that. So we have to move from the victim mode to the I can do this attitude. There have been countless studies proving that a positive mindset can affect the body in really powerful ways over a huge spectrum of medical conditions. Knowing that you can heal yourself is so empowering. You can move from victim to vitality, and I've helped so many women do this. And they don't do it alone because there's so much guidance and support in my Fibroid Freedom program. So I want to end this section with a quote from Pope Francis. Being happy is to stop feeling victimized and become the author of your own destiny. So we're going to switch gears here, and Jolena, do you have a question you can save to the end, or I don't care, we can do it now. Do you have a preference?
I have questions, but I just realized my hand was up on the computer and I didn't put it up. It just does that every moment.
Okay. Yeah. Okay. So now this is something new for me. Let's see if this works. And I will share. Let me share this slide. Can you see this and hear it? Okay, so we're going to take a little break from all the head stuff and we're going to do a little guided meditation. So rest your hands on your lower abdomen. Can you still hear me talk? Okay. Close your eyes and take a deep breath, feeling your connection to the chair and through your feet into the center of the earth. As you breathe, imagine drawing in the life-giving breath that connects you to Mother Earth, the Creator, the source of life. Feel this deep connection from your seat, through your feet, down to the center of the earth. Recognize this connection as a powerful, nurturing force that supports you as a woman. Inhale this energy into your pelvis, allowing it to flow up your legs and into your core. Be aware of the continuous, circular flow of breath in and up to your pelvis, and exhaling down to Mother Earth. Continuing this circular flow of connection. Our womb is the center of creativity, nurturing, and life. Breathe deeply into your belly and your pelvis, filling them with the powerful, omnipresent, feminine energy of Mother Earth. And feel yourself becoming one with Mother Nature. Inhale deeply, filling your pelvis with life-giving energy, and feeling your inborn power as a woman. Accept that this power is also love, synonymous with the force that created the universe. The very essence of love lives deep inside me and is always available to me. As you breathe, nurture and heal any parts of you that may have been wounded a long time ago, a short time ago, or even in the present. Healing yourself with love and acceptance. Pull that energy up into your body and letting it fill every part of your pelvis, so that every part of your female nature is filled with healing, nurturing, love. And feel the tingling of life deep in your core. As you continue to breathe, allow the energy to now fill every part of your body, grounding you in the eternal and omnipresent feminine. Recognize that every organ in your body is nurtured by this loving energy. Inhale from the earth into your source of life and power, and fill your entire body like a balloon. Allow it to radiate beyond the surface of your skin until you are completely bathed in this energy. Let this life energy stream out the top of your head, radiating feminine love and healing into the world. Accept and empower yourself with this energy, knowing that as you heal yourself, you can heal the world. Take a deep breath, feeling the powerful maternal life force radiating within and around you. And know that you're connected to the earth, feeling your feminine power and healing. In this bubble of energy that surrounds you, allow this energy of creation and love to surround any part of you that still needs healing or more love. When you're ready, gently open your eyes, carrying this empowered energy with you. Before we move on, is there anything anybody wants to share? We'll have time later too. I hope we'll have time for questions and discussion. So it's time for key number 2. Make a commitment to empower yourself to heal. So Let's look at the consequences of some of our choices. Number one, you can do nothing and let the chips fall where they may. If you're living with and tolerating a fibroid, you can take your chances. But having a tumor is a sign that your health is in some way compromised and probably not going to improve as time goes on. Number two, you can follow the conventional medical approach and suffer the consequences of surgery and medication and take the chance that it might not even work. Or number three, my favorite, you can allow this to be a wake-up call for the rest of your life. I remember when I had the epiphany that I had the power to take charge and heal myself. After a lifetime of doctors and hopelessness, just the empowerment that came from that decision was healing. And that's what I want for you, to have that feeling of joy that comes from knowing that what I do matters. And that's what I'm asking you to do today, to be willing to dive deep into your inner power, to make a commitment to be that woman that takes her life into her own hands and walks the road to self-healing. Hippocrates, the father of modern medicine, said, "Be the wind that sets your journey to healing your body and mind to sail." Natural forces within us are the true healers of disease. So key number three, and you probably remember the slides, is to take action. Obviously, you're not going to shrink your fibroids in an hour, or maybe you will. I have regularly seen miracles in my practice, and I think I shrunk mine in a few days. But I'd like to send you home with some things that you can begin to do. The first thing I would do is spend some time every day connecting with your feminine self. Maybe do a meditation like we did together. Take a hot bath. Lie down with a hot water bottle on your lower abdomen and focus on sending energy to your womb. Start to look at the ways that you cut yourself off from your creative feminine power. The other thing I strongly encourage you to do is to cut down on protein intake. I know you've been brainwashed into thinking that you need it, but mostly that's unfounded. Protein is a building block. And since we already have a body, we don't need another one. Our kidneys are really smart and they don't pee out the amino acids that are a breakdown product of protein. So in addition, there has been research proving that animal protein is the most important factor affecting the aging process. Okay, what's aging? Deteriorating health. So I think that what happens with too much protein, a building block, is that the body tries to figure out what to do with it. Since it's very hard to digest, it's not burned as fuel, so the body dumps it. It's like, I'll just dump it into the arteries and make plaques, or into the joints, let's make some deposits. And it starts building things like tumors. I know that, well, all I can say, I know I was just sort of anthropomorphizing the body. But for years, I have been having my patients for almost 50 years on a low protein diet. And over the years, I have said, well, I know this works, but someday they're going to do research and prove me right. And I cried when I read some of the current genetic research on aging, proving that protein, particularly animal protein, is the number one factor in disease and aging. It's been my experience. So the most powerful tool that I use to shrink fibroids is a therapeutic juice fast. I don't recommend you do this on your own, but you could try fasting for one day on unlimited quantities of fruit juice. And if you're overweight, I would make it a priority to get down to a leaner weight. So the three keys in summary are to educate yourself. And I hope that you've learned a few things here today. Number two, make the decision that you have the power to take charge of your health and heal yourself. I hope that you're feeling more confident that you can do this. And number three, take action. So what you can do now is connect with your source of feminine power and lower your protein intake, especially regarding animal foods. So I'd like to hear from you now after all that head stuff. What are your key takeaways so far from today? Anybody want to share, either verbally or in the chat?
I love that you're bringing in the mental emotional piece, the metaphysical aspects. I love that you're bringing those in, and it was surprising to me to hear a medical doctor saying that mindset is the number one intervention, essentially. So that's a takeaway. The protein, I have questions, being a woman in menopause, where I'm being told by other doctors to up my protein. So it's confusing.
Well, we can talk about this in the Q&A. I mean, it
Okay.
always brings up, what? And I know it works because I have literally watched my patients age in reverse over the years. Okay, fasting is the number one tool to do that. But I've watched my patients of every disease possible actually get better because we don't need it but anyway, because I know that's controversial and we will have time in a few minutes to talk about that.
Certainly, I don't think anybody's died from eating too many vegetables.
Well, I call him a mentor. I didn't know him personally, but one of my chiropractor mentors when I was first healing, after a toxemia pregnancy and all number of things, he knew Dr. Norman Walker. And the last 3 years of his life, all he had were fresh juices. That's all he lived on. And he lived to like 117 or something, but whatever. I have supervised thousands of even water fasts. And so I do not get scared about deficiencies, which were anyway, obviously I could get on my soapbox and keep going. So let's take one more step. And then we can, have some conversations. And anyway, this was a last minute, I'm going to do this talk again. And I am so grateful to see you here. And I'm honored that you're sharing some of your personal stories with me. That doesn't go unnoticed. I really honor your sharing. And I want to I want to share a story. Anyway, I gave a talk earlier today in another meeting, and it's like, okay, I can do this. I want to share a story of a client that I worked with recently. She was a publisher and a writer, a single mom with 4 kids, estranged from her husband, and was, at the time I met her, bedridden and in constant pain. Her little kids were helping her eat. She had recently had surgery for fibroids, but it didn't help. She was on 4 medications with horrible side effects, and they weren't really helping. She was in constant pain, hardly getting out of bed. She was getting regular transfusions. And when I met her, she had already, in the next month, had an appointment to have another surgery to remove her uterus. So within 2 weeks of working with me, a remarkable shift happened. She reclaimed her mobility, experienced reduced pain and bleeding, shed the weight gained from the medication, mostly. And in an unexpected twist, when I saw her on Zoom, she was actually in England. She looked as if she traveled back in time. She looked at least 20 years younger. And even, she said, one of her children asked her, "Mommy, why do you look so young?" Okay, she was on a fast. And, you can visibly see that the years coming off. But within 2 weeks, she was incredibly better. And, that's one of the reasons I'm sort of now focusing on women's health care, because the more I study it, and the more I look at the politics of it, and the more I look at the suffering, it just hurts me. And what I've seen is that when women commit to getting support on their journey of healing, a few things happen. First, they start feeling better. And second, they realize they're not a victim of their body. And by aligning with natural healing, they start to feel hopeful and powerful. If they struggled with weight, they learn how to put that in the rearview mirror. It is so empowering to realize that they really can turn their health around and just keep getting better and better. If you've struggled with fibroids, or even any of the symptoms we've talked about, when you learn these tools and practices, you start to experience a vitality and a confidence and joy at being a woman. I am committed to helping as many women as possible break free from fibroids, from being neglected and not listened to by their doctors, by stopping the suffering that it feels like just goes along with being a woman. I don't know about you, but during the years before menopause, the whole thing of having periods and even birth control, all that stuff was not something I took great joy in. And I think I don't want to see that for women, So I'd like to invite any of you to take me up on a totally complimentary one-on-one session with me, which I call the Vibrant Health Discovery Session. That's where we can assess where you are and look at some possibilities for the future. So this is for you if you're committed to embracing taking charge of your own healing and feeling the empowerment that comes from that. As I said, I've had so many women tell me, "I wish I knew you before I had so much suffering and had surgery." So if you know a woman who is suffering with that, please let her know. It just breaks my heart that there's so many women suffering needlessly and not being supported and not being listened to. So that's why I've opened up a few spots in my calendar to have a vibrant health discovery session. I'm committed to women having results like avoiding surgery, releasing pain and unneeded weight, having a reproductive system that's healthy in every way, in every age, and to connect more fully with their powerful feminine birthright. So during this session, we'll discuss your biggest challenge in your health journey and lay out a mini plan or a map for your healing journey. If it is a good fit to do work together, I'm committed to helping you discover what is out of balance in your body and discover tools that will help you heal. But not only that, you're guaranteed to become healthier and have tools that you can use for the rest of your life to continue in vibrant health. So I am going to share a slide. And the one thing I didn't do, share screen, is I do want to put my Calendly link in the chat, which will take me a minute to find, I think. So I do look forward to sitting down to actually every one of you, supporting you and seeing if it's a fit to work together, or if not, I would be honored to get to know you and hear your story. So I don't think that's a clickable link. I'm going to leave this up for just a minute, but for the rest of our time, I would be happy to answer questions, talk about anything that you might want to talk about, but I might have to multitask. Recent items. Yeah. Just give me a moment. Because I do want to get that link in there, and then here we go. And okay, that's done. So I want to go back to being able to see you and answer any questions, or if you want to have discussions about anything. So do you want to talk more about the protein thing?
Sure. Yeah, if you don't mind. And I know your recording is still going, so yeah, I'm just, it's just interesting to me, trying to figure out for myself which way to take myself. Yeah. And I've actually been, for the last month, cutting out sugar, like just really looking at not complex carbs, but simple carbs. Intermittent fasting. I've been doing 36-hour fasts and so on. So I'm very curious about fasting, but I'm going to sign up with you because I'd like a more comprehensive plan, because I feel like I'm sort of shooting in the dark a little bit, listening to what my body is saying, but not really confident on what I should be doing.
Well, when I was practicing medicine in New York City, I was actually an anthroposophic doctor. If you've ever heard of Rudolf Steiner or anthroposophy or Waldorf education.
Yes.
So if you know that, it's a very spiritually based way of looking at the world. Mm-hmm. So from day one of my practice, that was the focus, the overall, multi-layered human being that included the spiritual.
Mhm.
And of course, all of my mentors were from Europe because it's not practiced much in this country.
Yeah, I'm South African, so we're
Oh, yes. And mostly in like Switzerland is sort of the headquarters. And so even the mentors doing anthroposophic medicine and then the one doing research, all of them were talking about the negative effects of protein, not just on the body, but spiritually, how it affects us on all of our different bodies. And so from day one, with my fasting expertise and then with that study, because every food has an effect on every part of us. We don't think about that because we're very materialistically focused. Western medicine is pure materialism. Like I say, they don't even look at chi, which is our lowest higher body. It's the energy body. Then we have, personality and instincts, and we have a soul, So, and I think that's the limitation in Western medicine, because it does not look at the whole person. And that's why we end up with side effects, because all we care about is this little thing. Right. So from the very beginning, both philosophically and medically in my spiritually scientific medical study, because this isn't a spiritual kind of healing thing. They have hospitals in Switzerland. They do surgery. They have MRIs. I mean, it's just that they employ the spiritual on top of all of that. So it's the most holistic form of medicine. So it's really come from my experience. And all those times I've told patients, well, hey, I can't prove it. I see what works. And someday I know, I didn't think it would happen in my lifetime. But someday, and sure enough, I've been keeping up on all the longevity research on genetics, and I was listening to a book on tape by I forget which one. It's called Real Age, and she's a researcher at Yale University. And we've known some of the intermittent fasting things are kind of based on what we have known about calorie restriction being the thing that helps us get healthier as we age. But when I was listening and she was talking about that, she says, we've done further research, and what we've really found out, much more than the idea of calorie restriction, which, don't get me wrong, I think is important, is that the number one thing that turns on the aging genes is protein, especially animal protein. And I started crying because, I don't care. I know what works for me, but now Yale University, So all I can tell you, I can't prove anything. I know that this protein obsession in our country started after World War II, and it was based on the dairy and the meat industry, pushing the pyramid, and because we had the Depression and now we have money, so if you can eat meat, that's a good, and then don't get me started on the whole history of the fast foods and but I've been a vegetarian for, I don't know, God, at least 50, probably longer than that. I'm 76, whatever. Longer than that, I've been vegan for almost all that time. And so, especially in the old days, I don't get it. I'll admit her. You okay if I admit somebody 2 hours late?
Yeah.
She did this at my first one. She came in when we were finished. But anyway, hi, Miriam, if you're here. And now that threw me off. So, darn, I was making a point.
Vegetarianism and veganism.
Yeah, okay. And people always say, where do you get your protein? And my answer has pretty much always been, I try to avoid it. And I know that sounds glib, but I got so sick of people asking me, where do you get your protein? And I got so sick of telling them, I just say, which is true. And I have been on a very low, but understand there's protein in absolutely everything that we eat. If you look at a lot of the medical vegan sites, you know, they've got all kind of articles saying that if you get enough calories, you have enough protein. I mean, there's protein in an orange, for God's sakes. But what we call protein is meat, fish, eggs, dairy, nuts, beans, seeds, what I call concentrated protein.
Okay.
So when I say you don't need any protein, of course you need some, enough that you can get in a fruitarian diet, really. And the other negative thing about it, let me also mention it if I didn't sort of.
You want to see Rainbow?
Miriam, are you trying to say something? Oh, anyway. Here's the bottom line. The other thing, when people ask me, what's the most common thing you see in your medical practice? I always said digestive problems. It seems like the older we get, the less efficiently we're able to digest food. And underneath all the diseases that I saw, people are just toxic. If you do a detox, you know, then and stop overwhelming your digestive system. So protein is really hard to digest. Even, let's think about this. If we really needed it and can't digest it, what's the point? So you have to look really deeper at this whole question.
Thank you.
I know I kind of tend to go off on tangents, but is there any other thing that came up that anybody might have a question about?
I have another question. And this relates to the idea that fibroids will probably disappear in menopause.
Before I realized my talk was way too long, I was going to talk about myths. And one of the myths is that it goes away after menopause. However, there is some truth to that. They can go away after menopause because estrogen does make them grow. And as our estrogen levels go down, they at least probably stop growing. Whether they disappear. Again, if they're not doing sonograms and exams on women under 50 to see if they have fibroids, they're not going to see if a woman over menopause, probably. I mean, it's just, I don't know how that happened. Are women not getting pelvic exams? You can feel them. I don't know. Again, you can see I've sort of gotten a little stirred up about this whole issue.
I love your passion. It's great.
So yes, I mean, you are certainly less likely to get a new fibroid after menopause. Okay. Crystal, are you still there?
Yes, I'm still here.
So do you have any questions before we?
No, I think I've been doing a lot of research, and I'm gonna definitely book a consultation with you so we can speak further.
Okay. Well, thank you for being here. This really, I've loved meeting all of you. And thanks, Jackie, for supporting me. And look forward to, anyway, look forward to speaking to all of you in the future. So enjoy what's left of your weekend. Bye-bye. So, Miriam, you and I are here alone. Can you hear me?